Hey guys, this is Curtis Alexander. I'm a pharmacist. In today's video, I'll be covering a prescription medication called Epclusa. It's used to treat chronic hepatitis C. Okay, I've done a couple of other videos. I'll link to them in the description on other hepatitis C medications. So you'll see some similarities, but I want to hop right into. So Epclusa is what we would call an NS5A protein inhibitor. So what it's actually doing in the body is it's blocking, just like the other two, it's blocking viral replication of the hepatitis C virus. That's what we're trying to accomplish, and it does a very good job of it. Where we start to get some differences is in the dosing. First of all, in somebody who's treatment naive, meaning they haven't had any treatment before for hepatitis C, and if they don't have cirrhosis, okay, scarring of the liver, and so a lot of these things that we're talking about, they're going to look at before they ever treat somebody. They're going to measure the scarring level. They're going to look at what kind of genotype they're looking at. And one of the nice things about Epclusa, it covers a wide range of genotypes, genotype 1 through genotype 6. I live in the United States. So this video is done here. In the United States, most of our Hep C is genotype 1, a little bit of 2. So those aren't as applicable to a lot of people, but it's good to know that it covers a wide range. But normally the dosing for Epclusa is once a day for 12 weeks. That can differ if we begin to have decompensated Hep C, which means we've got more damage. And if that's the case, you got a couple of options. They can extend the therapy out for 24 weeks, or they can add a medication called ribavirin. And that depends on if the person can take ribavirin. I don't want to get into that right now, but that's the basic dosing regimen. That's probably one of the biggest knocks, is that it can be a little longer therapy, whereas you have a medication like Mavyret, which can go 8 weeks. And even in some cases, Pharm.D, one of the other medications, can go 8 weeks. All right, and this is the same for all the medications used to treat Hep C, is it can actually cause hepatitis B reactivation. So we have to test people before they receive Epclusa. Do they have Hep B? If they do, we have to be very careful, because you can cause reactivation, and it can be severe. It can be life-threatening. So it's not something we want to mess with. So that's a big one. Side effects, fairly well tolerated. Headache in 22% of people. I don't do as much Epclusa. I don't see it as much as some of, like, for example, the Mavyret, but the nausea and fatigues tend to be, they didn't occur as much in studies, but those are the ones I have people complain about more when they take it. But these are kind of your big three. All in all, it's fairly well tolerated considering what we're trying to treat. Okay, now monitoring is the big one, where these medications, it's extremely important that we get the monitoring right. The other thing that's extremely important is that we not miss doses. You know, we call this compliance. It's extremely important. We start missing doses, we start decreasing the chances that you're actually going to be able to cure the Hep C. Okay, so with monitoring, before you get going, there's going to be a ton of labs they have to do. Again, obviously we're going to monitor the hepatitis C. We have to know, do they have hepatitis B? Get a complete blood count, get an INR, which measures how fast your blood is clotting or not clotting. For women, we have to have a pregnancy test. We do have to test for the genotype. If somebody comes up as a genotype 3, most of the time they're going to look at doing some resistance testing, further testing beyond that. Okay. While you're on therapy, during those 12 weeks, they are going to be monitoring your liver function tests, because we can see some liver issues while you're taking this. And then after therapy, they are going to measure, it's got to be at least 12 weeks after you're done with therapy, they're going to go in and see, do you have detectable hepatitis C levels? And that's where we determine that, yes, you're cured, no more hepatitis C levels. So that's kind of Epclusa in a nutshell. The other two medications, again, I'll link to it in the description. We have Mavyret and Pharm.D. They all carry their pros and cons. They're all very effective. That's the bottom line. It's just with genotypes and some of these other labs that we draw on, that we're looking at on the status of the hepatitis C, may change the game a little bit. I will say that in America, Mavyret is the first line therapy. It doesn't make Epclusa bad, doesn't make Harvoni bad. It's just the preferred, and primarily because it's normally an 8-week therapy. So if you've had Epclusa, used it, know anybody who has, please post it in the comments. It's helpful for me, it's helpful for other people who watch the video, read the comments, and to get your experience. So it's kind of a hive mind. I appreciate you kind of chiming in that regard. So I hope this video was helpful, and until the next one, I will see you. Thanks.